Hi, my name is Darlene and I'm going to show you how to don and doff sterile gloves. Before we put them on, there are a few things you want to make sure to note. First, we want to make sure that we don't have any jewelry or loose clothing, so you want to make sure to remove those and pull up any loose clothing or take off any clothing that could get in the way of donning your gloves. If you have long hair like I do, you'd want to tie it back, but I'm just going to keep it in a braid and put it back. And then the surface that you're going to be working on, you want to make sure that it's clean. I would spray it down with some Sanicide, but for this video, I just have disinfectant wipes, so I'm just going to wipe it down with that. And before we get started on putting on our gloves, we do want to make sure that the package is not damaged, so we can see that it hasn't been tampered with. And we do want to verify the expiration date, so you can see here that it's 2019. We want to make sure that it's within 35 months of manufacturing, because once it's past that, it's considered expired, so then we can't use them anymore. So this is all checked out, packaging is good, and expiration date is within time frame. So now I'm going to go ahead and clean my workspace with some disinfectant wipes. Like I mentioned earlier, I would have sprayed it down with some Sanicide spray, but I don't have that, so these will do. All right. Now that I've cleaned up my workspace, I'm going to go ahead and wash my hands. Okay, now that I have finished washing my hands, I do want to make sure I have the proper body mechanics. Ideally, I want the table along waist level, but it is pretty short, my table, so this will do, but I would have want it at my waist level because anything underneath is considered not sterile anymore. So, now that we have went ahead and washed our hands, I am ready to don my gloves. So what I'm going to do is I'm going to go ahead and grab my gloves and I'm going to open it just like this. Anything on the outside of the package is considered not sterile, so right now this is okay, but the inside, the packaging in here is sterile. So I will show you how to properly do that. So I'm just gonna open it like this, just like that, and we're just gonna let it flip it there. You can go ahead and throw this away. Okay. Now, anything on the outside is still not considered sterile, so we have to be very careful. So what you're gonna do first is you're gonna take it and open it up, lay it flat like this, go ahead and carefully open it up like this, remove the flaps just like that. And then, like I said, anything in the inside is sterile, so that's why they created these flaps here for you to open it up like this, grab it, and keep it just like so. Flatten it out so it's easy for you to work with. So now that we've opened up the package, everything within 1 to 2 inches of this package is considered sterile, so you want to make sure that we don't want to lean over it. Since this is our sterile field, I want to make sure that I don't turn around and come back, because then it's considered not sterile. So this is my field and I want to make sure that I keep it that way. So to don your sterile gloves, you want to first don your dominant hand, and for me that is my right hand. Anything on the outside of the gloves are considered sterile. Anything inside isn't, so it's okay to touch the inside. So I'm going to pick up my non-dominant hand, still on the inside, and try to slip my hand through. Kind of get comfortable in there, try to let it slide down just like that. Now that we have our sterile glove on, anything on the outside of this glove is considered sterile. So you want to make sure that you touch only the outside of the non-dominant hand glove, because you want to make sure it stays sterile. To do that, you're going to grab the outside of the flap just like this. I'll turn it over so you can see it. grab the outside of the flap just like this and try to open up the inside so my hand can go through. Pull it down and we're sterile. So now we're gonna go ahead and doff our gloves. Everything on the outside is considered contaminated, so we wanna make sure to keep it in the inside. So to do that, you're going to grab the inside of the glove and pull it out, making sure that you are not in contact with the outside. Ball it up in the other side. Take your other hand, slide it in the inside, and remove it inside out. Put it in here, throw it up, and throw it away. So the difference between clean and sterile technique is that with the clean technique, we're essentially reducing the number of pathogenic microorganisms in the environment, whereas in the sterile technique, we're essentially working in the absence of these microorganisms. So essentially want to make sure that we're kind of avoiding and preventing the possibility of introducing new microorganisms in the environment, and ultimately trying to prevent infection. So the type of patient population we'd use the sterile technique on are those with a low immune system. That's because with the sterile technique, we are essentially working in an environment in the absence of pathogenic microorganisms. And so those with the low immune system, we want to make sure that we don't introduce new pathogenic microorganisms because obviously their bodies are unable to fight that. Whereas using the clean technique, we're trying to reduce that number, but with the sterile technique, we want to make sure we avoid it. We cut the line, we cut the path of that. Again, infection. We're trying to avoid infection. So those who are vulnerable to infection are those that we would use the sterile technique on. And yeah, well, thanks for watching.